Hello, my name is Laura Poci. This is DNPU 705 with University of Massachusetts Global, and I will be talking about my poster on assessing causes and strategies to reduce against medical advice discharges among alcohol detox patients in an inpatient setting. So we do know that approximately 1 out of 7 alcohol withdrawal patients do discharge against medical advice. And this posters aim to present a professional brochure to discuss the causes and strategies, of course, to reduce against medical advice discharges amongst alcohol withdrawal patients. So some risk factors include, and but are not limited to, poor judgment of the patient, co-occurring mental illnesses, lack of social support, financial constraints, transportation issues, and responsibilities at home. That might be one of the risk factors for somebody to for the patients to live against medical advice. So my clinical scholarly project involves implementing measures to reduce against medical advice discharges by addressing the above issues in my setting, which of course will be an inpatient mental health hospital. So we are going to utilize health communication among the different interdisciplinary teams, especially during handoffs, um, to be able to hopefully understand and be able to reduce the against medical advice discharges. So pre-admission screening will be done to identify risk factors that we did list above, and to support those risk factors to minimize these charges against medical advice. So I try to do the posters concise and as straightforward as I could get it, right? So there is the professional education posters right here. It talks about discharge instructions, and before you discharge the patients, what are the things that we need to consider, correct? So we need to consider the health literacy of the patient. We need to consider the patient's language barrier, if there is one, as well as giving that patient autonomy to make those decisions for themselves, but while still supporting them along the way. So the second thing that we'll talk about is the components of discharge instructions. So what does that mean? The diagnosis, the prognosis, follow up, and of course return to the hospital if they live against medical advice. So we need to understand that patient's diagnosis, help them understand what that looks like, what the prognosis are for that diagnosis, and then follow up care, as well as the potential for them returning back to the emergency room. We need to improve the discharge process by collaborating within the healthcare team, interdisciplinary team, taking a moment, of course, to educate the patient and understand where they're coming from and support them, and giving out written discharge instructions. So that would help. So my brochure will be talking about preventing against medical advice discharges among withdrawal patients from alcohol. You know, it does increase, hospital readmission rates. Um, Patients that might live against medical advice, they could have some medical complications such as seizures, delirium, tremors is a big one, or even death. And why would patients even live against medical advice? So some financial constraints, poor judgment, lack of insight, lack of social support, um, transportation issues is a big one as well. And then looking at the admission process, the process why they are in the hospital, and the process of them discharging, why supporting the patients and giving them the autonomy to make those decisions. Thank you very much. And here are my references.